Okay, here's a potential outline for a 20-minute textual piece on managing thyroid issues in older adults, broken down into key points. We'll be exploring a condition that often hides in plain sight. Its symptoms easily mistaken for the natural process of aging. This isn't just about a little fatigue or a slight chill. It's about understanding how a butterfly-shaped gland in your neck can significantly impact the well-being of our senior population. We'll delve into the intricacies of both hypothyroidism and hyperthyroidism, examining how these conditions manifest differently in older adults compared to younger individuals. The goal is to equip you with the knowledge to recognize the subtle signs, understand the diagnostic process, and navigate the treatment options available. Think of this as a roadmap to better thyroid health for the older adults in your life, empowering you to advocate for their well-being and ensuring they receive the care they deserve. Now, let's dive into what we're calling the silent epidemic. Thyroid disorders in older adults are more common than you might think, affecting a significant portion of the population. The real challenge lies in the fact that their symptoms often mimic the natural effects of aging. Is that fatigue simply a sign of getting older, or could it be an underactive thyroid? Is the weight gain just part of life? Or is a sluggish metabolism to blame? These overlapping symptoms contribute to a concerning trend. Underdiagnosis. Many older adults with thyroid problems go undiagnosed and untreated, leading to a diminished quality of life and potentially exacerbating other health conditions. Recognizing this prevalence and the potential for misinterpretation is the first crucial step. We need to be aware of the subtle clues and understand that thyroid disorders aren't just a younger person's problem. They are a significant concern for our aging population. Before we delve deeper into the specifics of thyroid disorders in older adults, let's take a moment for a quick refresher on the thyroid gland itself. This small, butterfly-shaped gland, located at the base of your neck, plays a vital role in regulating your body's metabolism. Think of it as the conductor of your body's energy orchestra. The thyroid produces two primary hormones, triiodothyronine, T3, and thyroxine, T4. These hormones travel through your bloodstream, influencing nearly every organ in your body. They regulate how quickly you burn calories, how fast your heart beats, and even affect your mood and cognitive function. In essence, T3 and T4 are crucial for maintaining energy levels, body temperature, and overall health. When the thyroid isn't functioning correctly, producing too much or too little of these hormones, it can throw the entire system out of balance, leading to a variety of health problems, particularly in older adults who are already more vulnerable to age-related changes. Now, let's turn our attention to hypothyroidism, or an underactive thyroid. In older adults, the signs of hypothyroidism can be deceptively subtle. Think about it. Fatigue is a common complaint as we age, as is constipation. Cognitive changes like memory lapses or difficulty concentrating, often attributed to senior moments. Depression, sadly, a prevalent issue among older adults. Muscle weakness could be seen as a natural decline in strength, and feeling cold more easily. Well, the blood thins, right? These are all classic symptoms of hypothyroidism. But because they so closely resemble the expected changes of aging, they are frequently dismissed or overlooked. This is precisely why hypothyroidism can be so insidious in older adults. It's not about ignoring these symptoms entirely. It's about recognizing that they could be more than just aging and prompting a conversation with a healthcare provider to investigate further. Now let's shift gears and discuss hyperthyroidism, or an overactive thyroid. While we often associate hyperthyroidism with classic symptoms like weight loss, rapid heart rate, anxiety, tremors, and heat intolerance, the presentation in older adults can be quite different, often described as atypical. In fact, some of these classic symptoms might be absent altogether or significantly masked. Instead of anxiety, an older adult might experience apathy or depression. Instead of a racing heart, they might only have subtle changes in heart rhythm, easily missed during a routine checkup. Weight loss might be attributed to other age-related factors. This leads us to a particularly challenging form of hyperthyroidism called apathetic hyperthyroidism. In these cases, the dominant symptoms are often fatigue, weakness, and depression, making it even harder to distinguish from other age-related conditions or even hypothyroidism. Recognizing these atypical presentations is critical for accurate diagnosis and timely treatment. Given the challenges in recognizing thyroid disorders in older adults, the importance of screening cannot be overstated. The diagnostic process typically begins with a simple blood test to measure thyroid-stimulating hormone, or TSH. TSH is produced by the pituitary gland and signals the thyroid to produce T3 and T4. If the TSH level is abnormal, further testing, such as a free T4 test, is usually performed to assess the actual level of thyroid hormone in the blood. While routine screening for all older adults is debated, it's strongly recommended for those presenting with unexplained symptoms that could be related to thyroid dysfunction. However, interpreting these lab results in older adults requires careful consideration. What is considered normal for a younger person might not be optimal for someone in their 70s or 80s. Factors like age-related changes in thyroid function and the presence of other health conditions can influence the interpretation of these tests. When hypothyroidism is diagnosed, the standard treatment is levothyroxine, a synthetic form of T4. However, treating hypothyroidism in older adults requires a particularly cautious approach. Unlike younger individuals, older adults are more sensitive to the effects of levothyroxine. Therefore, it's crucial to start with low doses and gradually increase the dosage as needed, under close medical supervision. This start low and go slow approach minimizes the risk of side effects, such as heart palpitations, anxiety, or insomnia, which can be particularly problematic in older individuals. Regular TSH monitoring is essential throughout the treatment process. These blood tests help the healthcare provider fine-tune the levothyroxine dosage to achieve optimal thyroid hormone levels. The goal is to alleviate symptoms and improve quality of life without inadvertently causing hyperthyroidism, overtreatment, which can lead to bone loss and heart problems in older adults. Finding the right balance is key. The treatment of hyperthyroidism in older adults presents a different set of challenges. The primary treatment options include radioactive iodine, anti-thyroid medications, such as methimazole, and, in rare cases, surgery. Each option comes with its own set of risks and benefits, which must be carefully weighed, especially in the context of an older adult's overall health. Radioactive iodine is a common and often effective treatment, but it can lead to hypothyroidism, requiring lifelong levothyroxine replacement. Anti-thyroid medications can control hyperthyroidism, but they carry a risk of side effects and require close monitoring. Surgery is generally reserved for specific situations, such as large goiters or when other treatments are not suitable. Crucially, managing cardiac complications is a top priority in older adults with hyperthyroidism. Rapid heart rate and atrial fibrillation are common and can significantly increase the risk of stroke and heart failure. Therefore, medications to control heart rate and prevent blood clots are often necessary. Alongside treatment to address the underlying thyroid problem, it's crucial to understand that thyroid disorders don't exist in isolation. They can significantly impact and exacerbate other existing health conditions, especially in older adults. For instance, both hypothyroidism and hyperthyroidism can worsen heart disease, increasing the risk of heart failure, arrhythmias, and other cardiovascular problems. Hyperthyroidism, in particular, can accelerate bone loss, leading to osteoporosis and an increased risk of fractures. This is a significant concern for older adults, who are already more susceptible to bone thinning. Furthermore, thyroid disorders can negatively affect cognitive function. Hypothyroidism can contribute to memory problems, confusion, and even dementia-like symptoms, while hyperthyroidism can lead to anxiety, agitation, and difficulty concentrating. These cognitive effects can significantly impact an older adult's independence and quality of life. Therefore, addressing thyroid issues is not just about managing the thyroid itself, but also about protecting and improving overall health and well-being. A critical and often overlooked aspect of managing thyroid disorders in older adults is the potential for medication interactions. Older adults often take multiple medications for various health conditions, increasing the risk of interactions between thyroid medications and other drugs. For example, levothyroxine can interact with anticoagulants like warfarin, potentially increasing the risk of bleeding. It can also affect the effectiveness of digoxin, a medication used to treat heart conditions. Certain antidepressants can also interact with thyroid hormones, potentially altering their effectiveness or increasing the risk of side effects. It's essential for healthcare providers to carefully review all medications an older adult is taking, including over-the-counter drugs and supplements, before starting or adjusting thyroid medication. Regular monitoring and dosage adjustments may be necessary to ensure the safety and effectiveness of all medications. Open communication between the patient, caregiver, and healthcare provider is crucial to minimize the risk of potentially harmful drug interactions. While medication plays a crucial role in managing thyroid disorders, lifestyle modifications can also significantly support thyroid health in older adults. A balanced diet, rich in essential nutrients, provides the building blocks for optimal thyroid function. Ensuring adequate iodine intake through foods like seafood and dairy products, in moderation, is important but excessive. Iodine can be harmful, especially for those with certain thyroid conditions. Regular exercise, tailored to an individual's abilities, can help boost metabolism, improve energy levels, and combat fatigue, common symptoms of both hypo and hyperthyroidism. Even gentle activities like walking or chair exercises can make a difference. Stress management techniques, such as mindfulness, meditation, or simply engaging in enjoyable hobbies, can help regulate hormone levels and reduce the impact of stress on thyroid function. These lifestyle changes, when combined with appropriate medical treatment, can contribute to improved overall well-being and a better quality of life for older adults with thyroid disorders. Caregivers play a vital role in the well-being of older adults, especially when it comes to managing health conditions like thyroid disorders. Because older adults may not always recognize or articulate subtle changes in their health, caregivers are often the first to notice potential problems. Caregivers should be vigilant in observing changes in behavior, such as increased fatigue, mood swings, cognitive difficulties, or changes in bowel habits. They should also pay attention to physical symptoms like weight changes, tremors, or skin changes. More importantly, caregivers should feel empowered to advocate for appropriate medical evaluation and treatment. This may involve scheduling appointments, accompanying the older adult to doctor visits, and clearly communicating concerns to healthcare providers. Caregivers can also play a crucial role in ensuring medication adherence and monitoring for potential side effects. By being observant and proactive, caregivers can significantly improve the chances of early diagnosis and effective management of thyroid disorders in older adults. To illustrate the challenges and successes in managing thyroid disorders in older adults, let's consider a couple of brief case studies. First, there's Mrs. Eleanor, an 82-year-old woman who presented with fatigue, constipation, and mild cognitive impairment. Initially, these symptoms were attributed to normal aging. However, her daughter, noticing a significant decline, advocated for thyroid testing. Mrs. Eleanor was diagnosed with hypothyroidism and started on a low dose of levothyroxine. With careful monitoring and gradual dose adjustments, her symptoms improved significantly, and her cognitive function stabilized. Then there's Mr. George, a 75-year-old man with a history of heart disease who experienced unexplained weight loss and a rapid heart rate. His doctor initially suspected a cardiac issue, but further testing revealed hyperthyroidism. Managing his hyperthyroidism with antithyroid medication and carefully controlling his heart rate proved challenging, but ultimately successful in improving his cardiac health and overall well-being. These cases demonstrate the importance of vigilance, advocacy, and individualized treatment approaches. The field of thyroid research is constantly evolving, offering hope for improved diagnosis and management of thyroid disorders in older adults. Ongoing research is focused on developing more sensitive and specific diagnostic tools to better detect thyroid dysfunction, even in the presence of other age-related conditions. Scientists are also exploring new treatment approaches, including more targeted therapies that minimize side effects and improve outcomes, particularly for hyperthyroidism. There's also increasing interest in understanding the role of genetics and environmental factors in the development of thyroid disorders in older adults. Furthermore, researchers are working on developing personalized treatment plans that take into account an individual's age, overall health, and specific thyroid condition. The ultimate goal is to provide more effective and safer care for older adults with thyroid disorders, improving their quality of life and overall health span. This continued research promises a brighter future for managing these often overlooked conditions. In conclusion, managing thyroid disorders in older adults is a multifaceted endeavor that requires vigilance, awareness, and a proactive approach. Early detection is paramount, as the subtle symptoms can easily be overlooked or attributed to normal aging. Appropriate treatment, tailored to the individual's specific needs and health conditions, is essential for alleviating symptoms and preventing complications. Ongoing management, including regular monitoring and medication adjustments, is crucial for maintaining optimal thyroid hormone levels and minimizing the risk of side effects and drug interactions. By embracing these principles, we can empower older adults to thrive, improving their quality of life, preserving their cognitive function, and enhancing their overall health span. Let's work together to ensure that thyroid disorders don't silently diminish the well-being of our aging population, but rather become manageable conditions that allow them to live full and vibrant lives. To empower you further in managing thyroid issues in older adults, here's a list of reliable resources for both patients and caregivers. These organizations offer comprehensive information, support groups, and the latest research updates. The American Thyroid Association, ATA www.thyroid.org, www.thyroid.org, provides evidence-based information on thyroid disorders, treatment options, and research advances. Thyroid Federation International, TFI, www.thyroid-fed.org, www.thyroid-fed.org, a global organization dedicated to thyroid awareness and support. The National Academy of Hypothyroidism, NAH, www.nahypothyroidism.org, www.nahypothyroidism.org, focuses on hypothyroidism and related conditions. The Endocrine Society www.endocrine.org, www.endocrine.org, offers resources for both healthcare professionals and patients on endocrine disorders, including thyroid conditions. Remember, this information is for educational purposes only and should not be considered medical advice. Always consult with a qualified healthcare professional for diagnosis and treatment of any medical condition. We hope this information has been helpful in shedding light on managing thyroid disorders in older adults. Thank you for your time.